Good morning, everyone. Good morning, good morning, good morning, and many thanks for joining us this morning. And I warmly welcome all of us to this first multi-stakeholder reflection and learning meeting on COVID-19 responses in Ghana. It's been 5 months or so since all of our lives in Ghana changed, and rudely so, by an invisible enemy of a COVID, showing no signs of exhaustion and leaving in its wake disruptions, but also some opportunities. Government, private sector, civil society are still grappling with what the state of affairs portend for the important work they do. It is often said that an unexamined life is not worth living. So today, I welcome you to this forum that we may examine our experiences, our response actions to the COVID, and most importantly, to envision a future with the disease and the important opportunities that we can mine to complement each other's work, to collaborate, and to coordinate each other's efforts. My name is Shamima Muslim, and I'll be moderating today's event with your kind cooperation. So without further ado, let me just indicate that this session is coming to you live from multiple locations, obviously, with all of our panel members and other special guests. We are also streaming live via the Facebook page of the West African Civil Society Institute, as well as the Star Ghana Foundation Facebook page. You can join us live with your comments as well, your own experiences lived, and your own vision of how we can curate a better future with the COVID. So we are jumping straight to the program. On the first item on the agenda, I'd like to invite and welcome the co-conveners for this event, the Executive Director of the West African Civil Society Institute, Madam Nana Asantua Afajinu. Big sis, good morning and welcome.
Good morning, Shamima. Thank you very much. So I think my role here really is to talk about why we are here. March, I think, was the month when we got the unwanted visitor of COVID-19 in Ghana. Threw all our lives out of gear. Has affected many of us privately, publicly, has affected us when you look at the different levels of society, our society, economy, politics. So many things have been affected negatively by COVID. And in response, government, the public sector, the private sector, civil society, have all in our different corners tried to work hard to fight COVID and to fight the effects of COVID and respond to those that have been mostly, affected by what's happened. And we have been working, but have been working in silos. And so this really is to provide a platform for us, first, to learn from what it is that we have done in our different corners, to share the experiences, to be able to document those experiences, and also to see in what ways can we work together? What are the opportunities for collaboration? Where can we complement each other? How can we coordinate better? And as we move forward, what is the plan? What are the next steps? And how can we make sure that together, as public sector, as private sector, and as civil society, we work to kick COVID out of Ghana and also address the negative impacts that have occurred because of this pandemic in Ghana. So really, this is an opportunity for us to share this, and I'm really grateful for the opportunity, Waxy, to work with Star Ghana on pulling this together. And we believe that it is going to be an interesting time for all of us, something that we can really document and move ahead. Thank you.
Thank you very much. And that was Nana Asantua Afajinu, who is the Executive Director of the West Africa Civil Society Institute, one of the co-conveners for today's program. So next on the agenda item, I would invite a solidarity message from Clara Osei-Boateng. She's the Governance Advisor at UK Aid Ghana. Clara?
Thank you, Shamima. Good morning to the Honorable Minister of Information, Kojo Oponkroma, whom I believe is. Hello, Shamima, can you?
Yes.
Hello, can you hear me, Shamima?
I can hear you, Clara. Yes, I can.
Okay, then. Yeah. Okay, so good morning once again to the Honorable Minister of Information, Kojo Oponkroma, whom I believe is online. Good morning to our fellow panelists and also ladies and gentlemen on this call for how far the pension. Hello.
Your hand, I think your hand is covering the camera somewhat.
Oh, okay. Unfortunately, our system does not allow Zoom, so I'm using my phone. So I guess that's why. Okay. Right. So yesterday I was reading through the project reports and I was amazed to see the scale of outcomes from the 8 partners over this short period of time, precisely 3 months, I believe. From reaching over 300,000 citizens with relevant information on COVID, fact-checking information, so that people will get the accurate information, and particularly targeting vulnerable groups such as persons with disability, who are sometimes forgotten by duty bearers. I think it was so amazing. I also found out how much one of the partners has done, training about 400 health workers across the country who have been provided PPEs and are now reaching up to 55,000 households in rural communities who usually do not have access to modern media platforms like social media to be able to get the information being circulated by other partners. I thought these are great achievements. And lastly, it was also refreshing to read that even though Star Ghana's mandate does not include providing direct services such as food, stimulus packages, face masks, and the rest, some of the project partners have been able to use the limited resources to leverage some of these resources to provide the basic necessities for the most vulnerable. I think these are very remarkable, and it's important that we share with other stakeholders, particularly governments, to see how civil society or what civil society contribution is. And I believe that all of these points to emphasize the important role of civil society in fighting the pandemic. The UK believes that civil society organizations with their local knowledge and expertise in policy development and networks at the grassroots are well placed to bring to the fore the needs of Ghanaians, in particular the marginalized community and groups, to further government's commitment to leave no one behind in pursuit of the SDGs, particularly as we battle this pandemic. This is why we consider this engagement very useful, to share and learn from other stakeholders in governments, in private sector, and other non-state actors. CSO's contribution being supported by the DFID UK government, the key successes and also failures from some of our interventions and the lessons learned from these failures. It is important that we see each other as partners in our fight against COVID by supporting each other's work. And therefore, it is the UK's expectation that today's event will help identify the potential areas of complementarity, coordination, and collaboration as set out in their objectives between government, private sector, civil societies to strengthen the effectiveness of their responses. You should leave this meeting with concrete actions to follow up to build partnerships among the different interventions and also ways to sustain this engagement so that civil society will be able to, in addition to contributing to the fight against the pandemic, also support government to ensure that their responses are effectively implemented by getting feedback from citizens on how these are impacting on their life and the mode of delivery. So on this note, we wish you very well in today's discussion, that the objectives as set out will be achieved, and there will be more of this in the months and weeks to come. Thank you very much, Shamima, and thank you, everybody.
Thank you so very much, Clara. We appreciate the framing that and the challenge that you have thrown at all of us. And for those who have just joined us, welcome once again. So this is the first multi-stakeholder forum involving government actors, involving the private sector and civil society. And the fact that we are all here today is an indication of collaboration in action. So we are seeking to deepen this collaboration by, first of all, hearing our experiences and our interventions during this COVID period. 5 months of disruption, and yet, as the report indicates, a lot of work has been done. So we want to find out what has been done, but most importantly, how we can increase efficiencies by not duplicating our, our efforts and dispersing our much needed resource. So as you think through the ideas, we want solid, actionable ideas on how to deepen the collaboration with the various stakeholders and how to complement each other's efforts. So without further ado, we have been joined graciously by the Honorable Information Minister, the Honorable MP as well, Honorable Kojo Opong Nkrumah. He would give us the keynote address and give us an overview. Of course, the state is the greatest and the biggest actor in the field of our COVID-19 response. So we want to find out an overview of our cases, our case management, the impacts especially on health, health infrastructure and health outcomes. It seems COVID is taking a lot of the advantages. What is the reports indicating about the effects on the other health outcomes that we want to achieve? On education, social protection in particular, so that the vulnerable are not further disadvantaged, and governance. So the Honorable Minister will give us this overview, then we'll go into our panel to now tease out the specific learning points. So welcome to this reflection and learning for Honorable Kojo Opong Nkrumah. If you're ready, we are here to listen to you.
Shamima, good morning and thank you for the opportunity. Let me say good morning to the teams that are joining us and to the organizers of this, what some will call learning or reflection meeting. It's good to see you and the many others who are here. But let me begin by thanking the leadership of the West Africa Civil Society Institute and Star Ghana Foundation for working together to create this platform and for inviting me to be part of the discussions. Now, you will recall that it was in March this year, just almost after the Independence Day celebrations, that we recorded our first 2 cases of COVID in Ghana. I recall that night when we were hurriedly called back into the Ministry of Health and the information was made available to us. And then we had to begin to activate all the things that we had planned, but we were hoping we would never have to execute. The government had to roll out a 5-part strategy, which had been drafted at the time. The first part of that strategy was to limit and stop the importation of the virus into Ghana. The second was to contain the spread within the Ghanaian ecosystem. The third is to provide adequate education for the population and care for the sick. The fourth is to limit the impact of the virus on the social and economic lives of Ghanaians. And then finally, to take advantage of the opportunity that COVID brings to expand our domestic capability and deepen self-reliance when it comes to production of COVID-related items and other items that may even outlive COVID. The implementation of these strategies cut across a broad spectrum of sectors. And for purposes of this engagement, I'll focus, as Shamima, you mentioned, on health, education, social protection, and governance, among others. So from government's perspective, educating the population is key in having people understand the nature of the beast we are fighting and how to participate in that exercise. And you notice that right from the onset, government, through the risk communications team of the Ghana Health Service, led by Dr. Boajida Costa, kicked in a series of education campaigns to sensitize the people on the safety, what we now call the safety protocols that we are supposed to abide by. The risk communication team has worked in close collaboration with the Information Services Department of the Ministry of Information to disseminate information on the virus in the 260 districts of the country. Now, government has also been sensitizing various identifiable groups, including the Ghana Independent Broadcasters Association, the Ghana Journalists Association, the Private Newspaper Publishers Association, PRIMPAG, the Ghana Medical Association, Ghana Registered Nurses and Midwives Association, and several other groups, with a view of, may I say, recruiting them as collaborators in the education exercise. Specific to formal education, COVID-19, as I'm sure you are aware, caused a suspension of formal education in Ghana. But after getting a clear sense of the dynamics of the virus in Ghana and how to contain it, you would notice also that we have gradually eased up some activity in our educational institutions to the extent that tertiary students have completed examinations. Final year students in the junior high and senior high are completing now. Continuing students in tertiary are returning from the 24th of August, and we look to ways by which we can get continuing students at pre-tertiary to also, probably in a phased manner, have some education. What we are now contemplating is how to, again, co-opt these students, particularly in senior high school, who have now become more or less ambassadors on COVID protocols as they go back home to help us take education to the next level and become ambassadors in their homes and their communities to get the message out. In the area of health, which is at the core of our 5-part strategy, the idea has been to limit and stop the importation while providing adequate care for people who have contracted the virus. And we took advantage of this also to boost local capacity through doing a number of things. First, we engaged the players in the pharmaceutical and textile industry to show up production of local sanitizers, PPEs, face masks, etc., to help us in protecting the Ghanaian population. We also now proceeded to make some investments in healthcare infrastructure and logistics required in the short term for fighting COVID-19, in the medium to long term for dealing with infectious diseases as well. We've also taken advantage of the current situation to invest in our testing capacity across the 16 regions of the country for various conditions, particularly PCR testing capacity. So our laboratories have also benefited significantly from machinery and from logistics for laboratory testing of other infectious diseases. And we've also been working to show up the work of other categories of health workers like psychologists who've been very key in helping us to manage patients who've tested positive. You would notice as well that COVID has also led to the government decision to invest in 88 district hospitals and some regional hospitals as part of shoring up the infrastructure for healthcare delivery in our country. In the area of governance and democracy, you'll notice that from day one, we've adopted an all-inclusive approach in dealing with this virus. We have had direct stakeholder engagements. The president himself has led direct stakeholder engagements with political parties, with civil society groups, with traditional rulers, all in a bid to achieve some commonality of purpose in fighting this COVID-19 epidemic in Ghana. As I mentioned earlier, we've also extensively engaged with civil society groups and media houses. And we have institutionalized a bi-weekly or a twice-weekly engagement with the country that allows us to update the country on where we are, the successes that are being shown, the challenges that we are having. And this also every now and then includes the president himself engaging with the country, and as our feedback channels provide him with information, using that information to amend or to tweak the decisions. The latest being the decision to provide 1 hot meal a day for students in final year pre-tertiary writing examination, because the feedback was that in compliance with rather the COVID protocols, some students were going hungry because they could not leave campus during the school day to buy food. And the feedback as we continue to engage is what has now led to an amendment of the program with which we are managing COVID. Social protection has also been key on our cards. It raised quite clearly the fact that we have not completed our database to identify the poor and the vulnerable here in Ghana. And so as a first line, even during the minimal lockdown period, there were obvious difficulties in getting food and support to the vulnerable, the street persons, and the homeless. It brings to the fore the need to complete this database as quickly as possible and to be able to identify such persons so that, touch wood, perish the thought, should we have need to lend a hand on such a large scale, we will be better organized than we were this time round. You also notice that His Excellency the President has been providing free water and free electricity for some category, electricity in particular for some category of consumers here in our country to support in this time of need. Government is also supporting businesses through what we call the CAPBAS business support, initially 600 million plus now 400 million, making a little close to $1 billion plus to support micro, medium, small scale enterprises that may have been badly hit. Government is also in the process of rolling out what we call the unemployment insurance scheme to support those whose jobs and incomes may have been direly affected by the COVID-19 pandemic. Colleagues, in all of these, government has created an enabling environment to make sure that the private sector quickly gets back on its feet and thrives. If you pay attention to the mid-year budget review as delivered by the minister responsible for finance, government is asking for an extra 11 billion Ghana cedis, a good chunk of which will go to support some of the productive sectors and quickly get the productive economy back on its feet so that we avert the potential second crisis, which is an economic crisis that usually follows a pandemic of this nature. Through this, the country, as part of these various support efforts, is expecting to quickly get our economy back on track. This year, you notice that though some economies are going into recession, we are still growing, albeit at 0.9%, a very sharp decline from our average 6.5% growth that we're experiencing. But the kind of investments that we are hoping to make in the medium term to revamp the economy, we expect will bring us on the path of very quick recovery. So I am hopeful that as we continue to implement these strategies, as we continue to have conversations about what more we can do, we will build on the successes that we've achieved so far and perhaps make some lemonade out of the lemons that COVID-19 dished out, not just to the entire world, but to the Republic of Ghana. I want to thank you for the opportunity to be with you, though I may not stay with you throughout the entire program. My colleagues from my office, my technical assistants are with us, and we'll do well to take the notes and the guidance that you will share. Shamima, thank you, and back to you.
Thank you very much, the Honorable Kojo Opong Nkoma, and many thanks for joining us and for the insights you've given on the work government has been doing so far to tackle this invisible enemy, COVID-19. So, I mean, you raised a number of interesting things. I lost a bit about the education. I think my network went off, but I captured the social protection. But I am hopeful that the panel members as we move to the next section, which is the panel conversation.
Hello, Shamima. Hello, Shamima. We can't hear you. I think there's a network challenge. Sorry, Shamima, we couldn't hear you. I think the line was cutting a bit, so we couldn't hear you.
Can you hear me now?
Yes, please.
Hello?
Yes.
Okay.
We can hear
so we are
you.
moving straight to the panel discussion. I'll quickly introduce the panel members. So joining us this morning, we have Mr. Senyo Hosi, who is representing the great work they did in building the 100-bed infectious disease control unit in record time, I must add. So there are some key learnings from that experience. We have Dr. Afisa Zakaria, who is representing the Ministry of Gender and Social Protection. We also have Dr. Franklin Esiedibekwe, who is the representative from the Ghana Health Service, and of course, Alhaji Amidu Ibrahim Tanko, the Executive Director for Star Ghana Foundation. So without further ado, I would first of all ask you, Senyo Hosi, to kickstart this conversation. I mean, we heard about government interventions, and we know that private sector also had to figure out a way of participating, although they were experiencing their own challenges. So we want you to reflect with us briefly in what ways the private sector has been affected by the COVID pandemic, some positive and negatives, as well as reflecting on the process that you undertook to build this hospital that you built. And you have just 4 minutes. And with the efficiency with which you were able to build this hospital, we know that you'll be able to tackle this question. It's a double-edged question. How has the private sector been affected on one hand? What was your own contribution to also solving the problem? And how did you go about it? Senyo.
All right. Thank you very much, Shamima, and good morning to everyone. Well, the private sector, we all sometimes forget, accounts for about 80% of Ghana's GDP. And that includes yourself, Shamima, and practically everybody here in their very persons. So being hit by COVID is a summation of how every individual and every corporate has been affected by COVID. We've had a lockdown, we've had changes in the demand patterns within the entire consumer space. We've had challenges with the global supply chain and the local supply chain. So yes, we've all been hit significantly. Demand on a number of things have really nosedived, but we've also seen some stability with other things. The opportunities it's brought is also the swift changes that you've had with demand patterns. There are things that are more in demand today than they used to be some years ago. So for us as entrepreneurs, there's a whole new world of opportunity that COVID has opened up to most of us. And that possibly, depending on where we position ourselves as a country, may actually be a panacea for us to actually thrive and lead the economic space in West Africa. We should remember West Africa is about over 300 million in population. And that's a huge market which we should be taking advantage of. A lot of people are worried about COVID and trying to respond to COVID in the short term, but we should be positioning ourselves more in the long term and see how we can dominate the economic space on the back of the opportunities that COVID has presented. One thing to also note is the fact that COVID is trying to tell us all to start looking inwards. When it mattered most, you had countries like Vietnam and Thailand cutting exports of rice. We should realize that when it matters most, people will look within. So let's look at how we can become a lot more self-reliant as a people. And that again opens a new space of policy positioning and business opportunities for us as a country. Having said that, Shamima, the private sector fund has not just been about the 100-bed or the infectious disease center that it built. We started off with a social intervention, which had to do with feeding, providing meals to the underprivileged persons in society during the lockdown. Our aim is to actually support governments and provide a swift response to the challenges that COVID presents us as a country, but all channeled towards supporting government's broader strategy against COVID. We recognize the fact that government will sometimes have challenges because of the bureaucracy it has, but the private sector can bring to bear its agility to support the country in delivering key response interventions in the fight against COVID. So the first thing we did was to serve about 150,000 meals, all right, to persons in Accra and Kumasi during the lockdown. We're the first to move to market. It took government another week to organize to come there. But that is also part of the support that we are supposed to bring to bear to government strategy. But we didn't do it alone. We had government support still, even in that. They provided us security and a number of things. Another thing we also worked on is what we call the Feed the Frontline project. We have been feeding since April some of our frontliners, particularly the medics in the key COVID centers. We've served over 3,300 meals, hot meals, to our frontliners since then, and that project continues to date. We've also had the Protect and Resource the Frontline, and that has delivered over 450,000 key PPEs, tertiary care PPEs, to the major COVID centers in the country. We've also provided training, COVID training for our medical frontliners as well. We're talking about the biomedical scientists, we're talking about doctors and nurses on how to manage COVID. And that enabled government open up a few more COVID care centers across the country. That is a project that's also ongoing. We are providing, supporting some of our key health centers also with equipment. We supplied, we donated about 10,000 test kits to Noguchi, and also supported them with other regions that they required to battle this entire COVID, or support the entire testing strategy of government. Having said that, we also identify stigmatization as one of the major challenges that we have, and possibly the new pandemic that we should be dealing with as far as COVID is concerned. And we've invested heavily in destigmatizing, in a destigmatization campaign, both dealing with this on the social media front, the media front, and also training key personnel. We've trained over 1,500 health personnel, security personnel on the management of COVID at the workplace, and try to deal with destigmatization. We're working with the NCCE and getting their boots on the ground across the country to ensure that we can educate a lot more people on how to respond to COVID patients. And that is also a project that's ongoing. We hope to see that through to the end of the year. And back to the project that probably excites you the most is the Ghana Infectious Disease Center project. We are hoping to have that replicated in 3 other centers beyond Accra. And that was conceptualized after engagement with government, trying to identify exactly where the key challenges were. We were very surprised when we went to the main center at the time, which was supposed to be reached, only having 4 COVID beds, and realized we possibly have a major challenge on our hand as a country. And that inspired us to start looking into the development of the Ghana Infectious Disease Center in conjunction with government. This has been done in conjunction with government, other state-owned enterprises, and other private sector donors, and including a lot of retail donors from us who donated as low as 66 pesos, and major corporates that donated up to 10 million cedis. And it's been one success that I think that we can draw a lot of inspiration from as a public-private partnership, and it's something we are all proud of, and we hope to have replicated across the country. Thank you. Over to you, Shamima. I don't know if I beat your 4 minutes or not. Shamima, you're muted.
Hello? Hello? Hello?
Yes, I can hear you.
Right. My network is acting up at me, where the private sector's ability to respond swiftly and coordinate very effectively. So in the next round, we'll find out how much we can achieve when we are not so consumed by who takes the attribution, who takes the reward, and coming together to really work to solve a problem. So in your next round, you tease out those key learnings. What was made within the time and doing what you're doing. So next to Franklin Esiedubekwe, who is with the Ghana Health Service. Dr. Franklin, welcome. Hello, Dr. Franklin.
Hello. Hello.
You know, when the minister was speaking, yes, thank you for joining us. I hope you can hear me. The question, and the minister alluded to it. So you woke up one morning and COVID was with us. Where did you start from as the key at the forefront of fighting the pandemic in attempting to formulate a response? And 5 months down the line, with the disease still on prowl, are we left with more questions than answers? Mr. Esiedubekwe.
Okay, and thank you very much. And good morning to the other participants and listeners. Yes, I think as was said by the minister, it was on the evening of the 12th of March, and we actually summoned to the ministry because we had actually confirmed 2 cases in Ghana. So Ghana was lucky, we didn't have a first case, we had 2 cases. A Ghanaian that had gone to Turkey, another guy who had gone to Norway. But let me say that we didn't start from zero because we had our public health emergency plan that was then activated. So you're looking at such a plan, you look at it at thematic areas, whereby it's based on the structure from WHO. So you have your coordination setup, you have your surveillance, you have your laboratory, you have your case management, you have your risk communication, you have your logistics. So those are thematic areas that exist. So immediately we confirmed the case, we actually activated our response. 5 months down the line, we have moved from 2 cases to 42,993 cases. So, but if you want to compare Ghana's trajectory to other countries, you realize that we are a bit slow. For 5 months, we've gotten only 42,000 cases. There has been a lot of inroads since we started, and let me say that for now we have, as of today, we have just 1,949 active cases, but we have recorded over 248 deaths. And our ability to achieve these figures is based on a lot of effort. For our approach as a country, the government was clear that our plan is all government approach and all society. So that's why we actually appreciate the support of CSOs in the private sector. And I think that as we go on, I will elaborate on the efforts of the other key players. So in terms of surveillance, that's ability to detect cases within and without the country. We started by strengthening our port of entries. And I remember those early days, there was a lot of pressure on us about trying to equip Putoka International Airport. But let me say that for a disease like COVID that has that long incubation period, it is not so easy to detect at the point of entry. But we try to improve our preparedness at the point of entry. And then the next issue was, are you able to detect the cases which occur in the country? So that is about building the capacity of the health workers. So through the government and other stakeholders, we train all doctors and nurses and laboratory scientists to be sure that we can actually detect the case if it should occur. So for now, we have actually trained almost all the key health workers in the country. The other challenge was the laboratory. Were we able to confirm a case of COVID in the country? At the initial stage, it was mainly Noguchi and cases here in Kumasi. But as I speak today, we have over 14 laboratories that are able to actually confirm COVID in the country, and 3 of them are actually private. So you can see that there's actually been a big improvement in terms of ability to confirm cases. The case management, I think, was said by Mr. Hosi. The early stage, we were supposed to have only 2 designated centers, that is Tema and then Ridge. But these 2 facilities had a combined bed capacity of just 14. So how are 14 beds going to address a disease as vigorous as COVID? So that led to the expansion of the treatment centers and the isolation centers. So as I speak now, all the 16 regions have some form of treatment capacities that exist. But prominently, we have 75 treatment centers that are mainly found in Ashanti and Greater Accra region. Then, because of our strategy that we were using, we were supposed to be able to isolate cases, but that came with the challenge of the availability of isolation centers. And then the private sector, including the churches, the mining companies, all have been very helpful in that perspective. So now, as I speak, we have this very big isolation center in Kaswa that can accommodate over 600 people. We have had a lot of the private sector actually renting hotels that have been used to isolate cases. So far, we do not have much of a big problem in terms of isolation and treatment. One challenge was, how are you going to manage our critically ill cases? And that brought to bear the need to have ventilators. And let me say that a lot of ventilators have been actually procured by the private sector to support our response. So now we have quite a number of ventilators. Risk communication is, how do you get the total population to be on your side? The idea was to allay fear and then to preach calm. And that calls to bear the need to have the media on our side, the general population on our side. So we have had a lot of CSOs, NGOs, all trying to promote awareness on COVID. So as I speak, I can say for sure that there's a high awareness on COVID. Maybe probably 100% of Ghanaians are aware of COVID. What we are challenged with is the capacity to adhere to the protocols. So that has been the direction. We had challenges with logistics.
When you say the capacity to adhere to the protocols, I think therein lies the bigger challenge. Because if the population is generally aware, the next challenge is, are they complying with the safety protocols? I mean, one has to take a cursory look around to see that people are truly not complying with the safety protocols. So how does that affect your campaign, your public education campaign?
Yes, thank you very much. I think that individuals have a way that they perceive disease. And we as, let's say, a service which is like kind of leading the response, we have taken this on board that behavior change is not just about awareness creation. It's also about enabling environment, it's about enforcement. So one thing that we were trying to ascertain objectively about people adhering to the protocols is by the surveys that we started doing. And let me say that it's early days yet, but the last survey that we did had over 44% of Ghanaians who were wearing the mask correctly. There were another about 38 that were having the mask but under their chin. So it tells you that there's an intention to wear the mask, but still we think that there's a high number that we need to get on board. You see, when people perceive the disease not to be that deadly, then they try to avert the precautions that they need to take. So it's a challenge for us as media, as a health service. How do we convince the average Ghanaian that your risk is somewhat dependent on you being protected? So I think it's something that we need to fight together.
Right. So briefly before I go on to the next panel member. So obviously you've spoken a lot about infrastructure, and we seem to suggest that in terms of infrastructure to deal with the cases and manage and treat the cases, we are on track. The next challenge is actually getting citizens who are now aware about the disease to comply with the safety protocols. What happens to the other health outcomes? Because the focus seems now on COVID. Obviously, there are other health outcomes. How are you keeping your eye on the ball for those other important aspects of our health?
Yeah, so
mortality, for example, is one of the areas that is being neglected.
Yes, it's an obvious challenge, but let me say that apparently this was very much visualized in the early part of the outbreak. So if you look at our approach for, let's say, Ghana Health Service, like our DG is somehow leading the fight for COVID, how the deputy DG looks at the other services. So we have regular Zoom meetings with our regional directors to be sure that we are keeping our eyes on the ball and not focusing solely on COVID. So I think that if we, based on our half-year analysis or our review meeting, we are not doing badly in terms of achieving the targets set for the other indicators. The early stage of the outbreak threw us off guard, but now I think we are on course to manage the other conditions.
Very well. Thank you very much, Dr. Franklin Esiedu Bekwin. And in the next round, we'll be asking from you, what kind of support do you need now in envisioning a future with COVID? Because obviously we are being told by the health minister and government actors that we have to envision a future where COVID, I beg your pardon, is embedded in the society. We have to live with it. What kind of help would you require, or support or collaboration will you require from the other stakeholders in this fight? In the next round, you take that. We come now to the Ministry for Gender and Social Protection, and we have Dr. Afisa Zakaria, who has joined us. Good morning, Doc.
Good morning, Shamima. Good morning, colleagues.
It's nice to see you, but I can't see you. I don't know if anybody else can see. I can only see the top of your head.
Oh, really? Let me position the... Is it okay now?
Yes, it's far better now. Beautiful. Right. So, Dr. Zakaria, the minister, when he was giving his keynote address, considered that there was an initial challenge with identifying who the poor and vulnerable are for effective targeting. So we all saw the chaos or near chaos situations when it came to the distribution of the meals and other items. Tell us, what was the plan of the ministry when it was clear that we were going to have a problem at hand, if you had any at all?
Yeah. Thank you, Shamima. Anyway, the line was breaking, so I didn't get your question very clear, but I've heard of data. We not having data available to be able to target the vulnerable very well. Yes, this is very true. Let me start by commending government, the private sector, our development partners, and Ghanaians as a whole for that strong collaboration during the COVID period, the lockdown, and till date. I mean, it's been so impressive And I have seen that if we want to do things, we can do and do them very well once we work together. Yes, as a ministry, when the pandemic, reached Ghana, we were all sort of surprised that we had recorded cases. Well, we tried to educate our people so that they will remain calm and then come to work. Then we started collecting data, because the data we were collecting on the vulnerable, we started from Upper East, Upper West. So the next place was to be Northern Region, Savannah, and Northeast. Unfortunately, during the COVID period, because of the fear, we were advised for staff, for us not to keep so many people in one office at a time. And so they had to be running shift. Then we were told we had to provide food. But we did not break at all. We still continued our services, because our services are towards the vulnerable. So we started by getting face mask, and also making hand sanitizers in collaboration with the Food and Drugs Authority of the Ministry of Health. So we were able to produce 17,000 of that, which we distributed to our target population. And then we started providing food, because at that time, during the lockdown, government gave us money to provide food for the vulnerable. And so the question was, who are we targeting? We haven't reached Greater Accra yet. We've not reached Ashanti region. And so we quickly stopped the targeting of the 3 northern regions. And then we did emergency data collection in the Greater Accra region, because that was the hardest hit at that time. And so we started cooking and targeting, reaching out to the population. But believe me, it was extremely difficult, because people were rushing for the food. And so it was difficult to even say you are calling name by name to give out the food. Mm-hmm. We did this in collaboration with NADMO, district assemblies, the local government service, and the Ministry of Local Government and Rural Development. So the caterers will cook the food, NADMO will take the food and then distribute to the people. But it was extremely, extremely difficult. People were literally rushing. Even our ministry here, they will come, you come, and the whole place is full. At a point, we were tempted to even be cooking for them. Some would jump in and for the food. So we started buying raw food also. That's uncooked food for them. Families that couldn't cater for their families. Because we have a helpline of hope, toll-free number where when they have problems, they can call. Many, many people call in just asking for food. And so we had to also buy and cook food for them. The other things we did, we also received donations. Right. Apart from government giving us money to cover these people through, that's by providing hot meals, we also receive donations. We receive donations from various people, different sources. And so we repackaged them and also distributed to our target population. Mm-hmm. Apart from that, the livelihood empowerment against poverty, the payment. What we did was to lump 2 cycles. We paid them every 2 months, but we had to put monies together so that they will have enough money to cater for their families. And so we paid for 2 cycles at a go, and also added money to them so that they could use that for transport. Those who stay away from the banks, they could use that for transport to get to the bank for their money. Initially, we were using other people to pay them. But COVID, we're trying to avoid the contact. And so we added up, and that was a way of complementing those who couldn't work during the COVID period and are vulnerable. Then we also provided accommodation. We have accommodation that, structures where we are able to accommodate people. And so those on the street, those facilities were made available for them. But the collaboration actually helped. It's helped a lot. And going forward, we will really
so Dr. Zakaria,
yes, please. Hello.
But this collaboration, was it a structured collaboration, you would say, or everybody was just doing? Because a couple of weeks ago, we did have a stakeholder forum. And one of the key issues that emerged was the non-representation of society in the committees that have been set up to respond to the COVID pandemic. So when you say collaboration, how do you envision this?
You said non-representation. No, the line is breaking. You said non-representation of.
I'm saying that a couple of weeks ago, when we launched the civil society platform, one of the key issues that emerged was the non-representation of civil society on the existing state-led committees. The collaboration, I'm asking vision into the future, this collaboration you speak about, to be curated.
Yes,
hello?
Hello, yes. You know, the pandemic, the way it happened is like everybody will just run in to get hold of what one can do to sort of help. Mm-hmm. So I believe moving forward, we've learned lessons from that. And then moving forward, where we see that there are weaknesses, we will address them, or we can make recommendations for the appropriate bodies to address. So the collaboration, where we talked of wasn't a structured collaboration. We got people who either wrote to us or made phone calls that they have these items and they would like to donate to the ministry or for these particular vulnerable groups. That was how it was done.
Also, from what you have said, beyond the food handouts, and I guess a lot of the interventions occurred during the lockdown period itself.
Yes.
So what have you been doing after the lockdown? And beyond the food handouts, have you identified other new vulnerabilities?
Yeah.
Because obviously people are losing their jobs, there are challenges with, the disabled groups. And what is your response? Okay. Your response to these new vulnerabilities and expanding vulnerabilities?
Okay. We have continued with our work. We realized that our work is very sensitive. And so we couldn't sit down like maybe other areas where maybe they will not need to go to work or something like that. So we have continued our work, and then we are doing the data collection. Currently, we are collecting data in the 3 regions. After that, they will move to Central region and Volta region to collect the data. So we have intensified the data collection. It's quite expensive doing data collection nationwide.
Right.
And we are doing this in collaboration.
In the meantime,
we are doing this in collaboration with Ghana Statistical Service. So they are on the field doing the data collection.
So beyond the data collection, are there any interventions to support people who are already, you know, marginalized and vulnerable?
Yes, there are other interventions. You know, our ministry, we have the livelihood empowerment against poverty that targets the poor. And so payments are ongoing. Then we have the Ghana School Feeding Program that targets the children. But because they're at home, we are in talks with World Food Program so that we can provide uncooked food to such families. So those families also will be provided with uncooked food. And then government is also implementing a new project that's targeting those who are at school and then writing their exams, the final year JHS students. And so this one, we are also planning to execute that. And social protection interventions, I mean, we'll also continue with that.
Thank you so very much, Dr. Zakaria. So we'll come back for the second round. So let me bring Mr. Amidou Ibrahim Tanko in now to organizations, and society has been doing important work over the years. You have some core competencies. Question is, what would you say has been the main lessons COVID has presented to the CSOs themselves, and your assessment of how CSOs have fared in attempts to survive the effects and their contribution to fighting them generally?
And good day to, I think thank you very much, Shamima, and good day to all the participants on this conversation. Civil society, a number of lessons have been learned, and I'll try to go through very briefly. I'm sure that in the follow-ups we can expand on them. I think one key lesson has been the issue around coordination of efforts. So coordination within civil society, among the civil society organizations implementing various interventions around COVID immediate response, but also looking beyond the immediate response to COVID recovery. That's given the scale of the pandemic, given the far-reaching effects, working in silos would not enable us or would not help us achieve the kind of results that we need. So there's a whole issue around the coordination, and Star Ghana Foundation with support from UK Aid has, and then in collaboration with other civil society organizations, have set up a CSO COVID coordination platform that is seeking to ensure better coordination and more joined up efforts. I think when we talk about coordination and collaboration too, we're also looking at between civil society and government, and between civil society and the private sector. And I think between civil society and government, obviously civil society brings a lot of competencies on the table, competencies born out of what civil society has done in the past, you know, around similar situations and around the issues of social accountability, and etc. And I think it's an area that has been least explored and been least taken advantage of. And I think that for us to be able to make an impact as a nation, there is the need for government to recognize the skills, the experiences, and the expertise that civil society brings to the table, and for government to reach out more, you know, to involve civil society. And of course, the onus also lies on civil society to also reach out to government. And of course, we talk about the collaboration between civil society and the private sector, of course, including the media. And I think given what the private sector has been able to do, the construction of the facility and etc., it shows what they bring to the table. This can be complemented, you know, with the competencies that civil society brings, so that together, you know, we can synergize, we can be able to, we can achieve better results. Civil society and the media, one of the biggest lessons that we've learned has been the issue of access to timely, relevant and responsive information to enable people adapt, change, respond to the pandemic. Star Ghana Foundation has been working with the Media Foundation for West Africa and a number of media organizations to fact check, to help put out more accurate information, has worked with the Ghana Federation of Disability Organizations to ensure that the information that goes out responds to the needs and the issues of persons with disability. So there's a critical need moving forward for this collaboration between civil society and the media. I think the second big lesson that we've learned is that the impacts of COVID on civil society in Ghana, also has its part of its roots in what is happening in the traditional donor countries. They have been very badly affected, and so support from these countries to civil society has declined. Some of the support has been repurposed, so stop working on this and focus on COVID and etc. Which then points to the need that's for, the promotion of local philanthropy. We do have local philanthropy, at various levels in our traditional lives, but I think it is not repurposing, but looking at how we can harness, the goodwill towards contributing in times of disaster and etc., to a situation where we are able to contribute to support longer term developmental efforts. There was that panic, response, people rationing with food, etc., which within that context was quite good. But I think moving forward to look at how we can promote local philanthropy as a way of sustaining the civil society sector to better respond to similar situations in the future. And the last point I want to make around the lessons learned is really about the fact that the effects of the pandemic are far-reaching. We've talked about addressing it in almost like silos, the health effects, the education effects, the economic effects, etc. But I think we need a more holistic approach to addressing the pandemic. Now, whatever is happening in the health sector has knock-on effects on what's happening in terms of the productivity, access to labor for private sector. Whatever is happening in the education sector has effects on, the social development of the country. And therefore, our planning as a nation should look more at a more holistic distance rather than say, okay, the health sector needs this number of hospitals and etc. Let's do that. And to take a longer term view of the planning, that the effects, we are seeing the immediate ones, but the long-term effects are going to be apparent very soon. And therefore to look at that, which then ties in with the need for a systems rethink, that we can't continue with the systems that we have now because there are drawbacks, there are inefficiencies have been exposed. If we look at education, yes, we talked about online classes and etc. But think of the majority of students who have been left out because they are poor or living in the private areas, do not have access to internet or the equipment to access the internet, and the way they've been disadvantaged. So how do we begin to reset, the systems to want systems that are more inclusive and reflect the lessons that we've learned during this pandemic. So overall, I think for me, these are some of the big lessons that we've learned. For civil society in terms of survival, for some, they've been able to access repurposed or reprogrammed funds from the donors, and that has helped. For others, beginning to look at how do we look within ourselves, to raise the kind of funding, which hasn't been easy. And therefore, quite a number of civil society organizations are struggling and on the brink of collapse, which would be a tragedy for this country. In terms of collaboration, the contribution, I think it's been immense and it's been mentioned everywhere. There are the spontaneous contributions that civil society organizations have made that, okay, let's put money together. So the civil society platform on the Sustainable Development Goals, for example, has set up a fund that has, mobilized some funding which is being used to support, needy people, help to mitigate the impacts on the needy. Star Ghana is implementing a COVID response program supported by DFID. And, as we was indicated in Clara's message, we have reached over a significant number of citizens with, services. One of our partners, for example, has trained over 1,000 health workers, on the use of the PPEs, on responding to the pandemic, and that is cascading into the quality of services that people are receiving. We have supported over 300,000 directly citizens to access services and etc. So all over, this support is going, the contribution has been immense. And I think that when we get the collaboration between civil society, the private sector, government, and other actors together, these contributions will even be more significant and would help us to make sustainable inroads into addressing the pandemic. Thank you.
Right. Great perspectives, Sir Mr. Tanko. We really appreciate the broad range of perspectives that you have given to us. So I think the next round is to take some questions, and then, Samuel agrees with me. I've just seen Samuel. So I'm going to take some questions from participants, and I'll throw it out to all members of the panel, and you are welcome to address whichever one you want to address. So, for example, this one says, how can we, from Claire Banoy Yakubu, how can we deal with the challenge of non-compliance, as that is critical in overcoming the pandemic? Christopher says, Dr. Franklin Etedu, your concentration was on those who did and did not put on the mask. What of those who can't due to existing health complications? Samuel Akobo says, different approaches to communication and messaging are needed for behavioral change. For instance, this is where religious leaders have value addition in this course. Caritas Ghana is leading this with the Interfaith Alliance. Robert says, can we get to know about about what the status of health workers is? How were they taken care of? I have only heard of hot meals for them. What's happened or has been happening? Raymond says, Dr. Esedu, thank you for your submission. Please, how prepared are our health facilities and health workers to continue to deal with this pandemic? And someone from Sierra Leone says he's Issa Bangura, thanks for happening. Samuel says, great reflection by Alhaji Amidu Ibrahim Tanko. We are learning that MMDAs have weak understanding stroke programming on social protection, especially in respect of COVID-19. They only speak generally about existing national protection programs like LEAP and school feeding. Right. Elom says, how gender responsive have responses to COVID been? One question to Mr. Tanko, during this pandemic, what has been the role of local philanthropic institutions in addressing the pandemic in Ghana? So, yes, many more questions are coming, but I think I would leave it at this and invite the panel members to pick any question that relates to their field that they want to address. So anyone who wants to go should start.
Okay,
okay, can I would start then. Can you hear me?
Yes, Dr. Franklin. Who is starting?
Okay, thank you very much. I think I had a few questions. It's about the face mask. I think that, let me say that both cases, a number of people can tolerate the face mask. There are only some few indications that you may not have to use a face mask. So I think that in the time past, to avert that, people started using the face shield. But the face shield is not serving the purpose of preventing you from getting the infection. So we actually encourage Ghanaians to make sure that you are wearing the face mask correctly. Correctly means that you must cover the bridge of your nose and then cover your mouth up to under your chin. And that is when we are sure that you get the necessary protection from being infected. When we did a survey, we looked at two things. Apparently, we were looking at whether people were putting on the mask correctly or they were not. And I think the idea is that is one individual intervention that hopefully, if adhered to, will get us on the right track to avert the pandemic. But it's not so easy for people who have lived all their life minus face mask to now adapt to face mask. Let me also even say that there are instances that people who wear the face mask in the presence of others, when they are speaking, they take it off. The whole essence of wearing the face mask is to have it on so far as it's a second person. And I want to use this opportunity to advise all Ghanaians that so far as there's a second person in your immediate surrounding, you need to have the face mask on. We will continue and urge all collaborators, CSOs, NGOs, that let's see how best we can get the average Ghanaian to appreciate that the face mask actually protects us from getting COVID. About health worker protection, the last data that we had over about 2,000 health workers that had been infected. And as much as possible, the Ministry of Health provided the necessary support. Let me say that what is obvious is a health worker getting the infection. It was not very evident whether he had it on the ward or not. But as much as possible, the ministry has tried to put in place the necessary logistics available to protect us. One thing which was very inadequate was the availability of PPEs. But now, as I speak, through local government support and then other partners, I think that the issue about PPEs are now being handled well. Thank you very much.
Very well, thank you. Of the issues.
In terms of my response, I would look at the issue of the role of local philanthropic institutions and the capacity of MMDAs, you know, to respond to the pandemic. Can you hear me?
Yes, please.
Okay. I think in terms of the response of local philanthropic institutions, it's been amazing. You've had, you know, institutions, organizations, informal, you know, philanthropic organizations responding at both the local and national levels, providing meals, providing, you know, support to vulnerable social groups, the poor, etc., etc. I think what is lacking, and of course we've seen the fund the private sector has set up, and also the response to government's fund. So that's, for me, is really significant. It provides a basis on which we can build to ensure that we do have fund and all funds at various levels of governance that enables us to respond, not just in the short term, but in the long term, because a lot of what is being provided now is the support is to meet immediate short-term needs. And I think that we need to look beyond the short term and see how we can have a fund. But that also looks beyond fiscal structures to looking at these softer issues. How do we support civil society to monitor and help hold government accountable for judicious, effective use of the resources. Where are the resources going? And etc. I think we need funding, we need support, and it's an area that we need to get local resource, philanthropic support to look at. In terms of the MMDAs, I would say that part of it is not their fault, that government's response has largely been very centralized, you know, and if we want to make an impact in addressing, responding to, and recovering from the pandemic, we need to put decentralization and local governance at the center, because that then enables us to have more targeted interventions, that then empowers local institutions and agencies to be able to work with citizens at the grassroots level. But so long as we have this top-down approach to development and implementation of COVID response plans, we'll run into these constraints that some of the responses do not respond to local or specific issues of particular social groups or geographic areas. And they rush the provision of, you know, hot meals in our context, for example, is an example of this contextualization that I'm talking about. In terms of the different approaches to meeting information needs, I completely agree. But let's look beyond the approaches. Let's look at the relevance of the information. Let's look at how timely the information is and how these pieces of information respond to specific, you know, needs and issues. And for us in Star Ghana, we have working with the Faith-Based Alliance hosted by Caritas to bring together the Office of the Chief Imam, the Catholic Bishops Conference, the Christian Council, the Ahmadiyya Muslim Mission, to develop and implement, you know, information provision services. We're working with radio stations across the length and breadth of the country to, you know, to fact check and put out accurate information. And of course, we're also working with the Ghana Federation of Disability Organizations to ensure that information that goes out responds to the specific issues and needs of persons with disability. But yes, it's true that we need to contextualize the information that we put out. Thank you.
So, thank you very much, Mr. Tanko. Dr. Zakaria, you know,
Yes.
there was a question about how perhaps limiting the government approach to social protection issues, because you seem to mention the vehicle of LEAP and school feeding as the only vehicles that you're using to target the most vulnerable programs, because obviously there are new challenges that are emerging as a result of COVID. And might you be interested in working with CSOs to see how to broaden this intervention basket?
Thank you, Shamima. Apart from LEAP and school feeding, we have other interventions, such as the domestic violence area. We have a secretariat where we are looking at domestic violence. And so with the toll-free number which we provided, people were able to call in to report cases of domestic violence. Also, human trafficking was very active at that time. And so we're monitoring, the traffic people and how to salvage the situation. So we are not limiting only our interventions to just the two programs. We have other programs that we are implementing. Just that the two programs have been well established and the targeting is well established as well. Whereas the human trafficking, we are looking at intercepting people, transporting or sending people to other countries to do other jobs or being used for other things that they shouldn't be used. And there was a question how sensitive our approach was. Yes, this was a crisis period, and I will say it was very sensitive in the sense that we were not selective. Whether you are a man, you are a woman, if you are poor, we took care of you. And so that was the beauty about the whole thing. So the whole execution of the intervention was gender sensitive. It was gender responsive. So this is what I believe with it. So whoever came, and we didn't turn them away. And also we worked with civil society organizations. Others will say the ministry did not reach here. Areas where civil society organizations were, because we were coordinating with them, then we moved to other areas. And so whatever was available was shared to the vulnerable without any discrimination.
Very well. Thank you so much. So let me just introduce the third round of questions and we'll try and wrap up. So this is where we are trying now to focus on teasing out, key learnings. Mr. Amidi Tanko has already spoken about some things CSOs have learned. So coming to this next round, I'll start with you, Senior Hosi, for this round. After listening to the health representative, the gender representative, and CSOs, and marrying it with your own experience, I now want you to perhaps explore with us whether you see any opportunities for collaboration and complementarity. I say this because obviously from the work that the private sector has done, which we saw the efficiencies, the quick responsibilities of CSOs, as well as what government wants to do. If we want to bring these actors together, what are the ingredients that will ensure some success? Senor. Hello, Senor. Hello? Can anyone hear me?
Yes, I can hear you.
Right. So,
hello,
Senor, are you on?
Yeah, I'm here. I'm here, Shamima.
Yes. Did you hear my question?
No, I actually lost you.
So over to you.
I mean, can you go over your question again?
Oh, so you didn't hear the question?
Yes, please.
So I'm saying that after listening to all the actors, your other panel members, we are now trying to find out what makes teams work. So you've heard about the core competencies of CSOs. You've heard about the challenges that perhaps the gender. So what makes teams work? If we want this collaboration to work, having efficiencies and have value for money from the successes of your own.
Okay, you still were breaking, but I think I got a fair idea of what the question was. You're looking at what teams work. I'll speak a bit more from our experience, and that's what I limited to. The success that we've been able to record has been driven more by the focus on the value that has to be delivered. We got in at a time of crisis, so there was little focus and attention on who takes credit for what. In our country, we have a big problem sometimes. Politics gets in the way of too many things, and we easily get lost on the key value that has to be delivered to the people of Ghana. We were privileged to have had that totally lost on everybody, so the focus will really be on delivering value to the people of Ghana. For example, we met our minister, the Minister of Health, in one meeting. The next minute we're meeting the president. We actually developed everything in less than a week, and we're hitting ground to really develop the first Ghana Infectious Disease Center. I'm pretty sure in a non-COVID time, there'll be some very long bureaucracy that we'll all have to go through. You have people from the private sector concerned about who is taking credit for what. But that was not the thought at all. We had only one person focus, and the focus was the people of Ghana. How do we help our country at that time of need? And that really rallied everybody on. So for us to really look at building teams, we must really keep the focus right. What's the object? The object is nobody who is in the team. The object is the people who are supposed to benefit from the output of the team. And once we keep that picture on, I think that it's much easier for us to rally and coordinate our affairs pretty well. And I say that because of our unique situation as a people, other than speaking typical business team building language. This is the core of our problem. I mean, and our team itself, building a team was also quite a challenge, because we also had people coming from different parts of the private sector. We also had various people donating their time, like the Ghana Institution of Surveyors, the Ghana Institution of Architects, Ghana Institution of Engineers. You had the military. Everybody was coming from different backgrounds, and we're now supposed to work together. And they had never worked together before as a team. The only thing that really got on is ability to rally around the focus. And leadership is key. Leadership is key. When those leading the charge are able to take themselves out of the picture and keep the focus as the picture, that helps drive success. And our advice that as we all work together on this, conversation about what this person has done or what this person has not done should not really be the focus, should be what has been achieved and what we can keep achieving as a people.
Mm-hmm. Hello, Senor.
Yes, Shamima.
Right, so awesome. So how might the private sector support building this platform to have, like some systems thinking in terms of approach? Because obviously we are stronger together.
We are absolutely stronger together. Our achievements would never have been realized without the support of government. That's why we call our interventions private sector led and not a private sector project, but a private sector led project. All of us are involved. The private sector has a certain measure of agility, it has a certain measure of transparency and competitiveness that delivers value to our country. We've done our project at $7.5 million. And this is inclusive of all the freebies and inclusive of also the tax waivers that we had. I mean, say for that, it would have been a $5.5 million project. How many projects will be able to deliver that in Ghana at this cost and at that price, at that speed? You wouldn't have that. So I think that there's a lot of room for us to really collaborate. One of the things we should be able to leverage and learn from this particular project is the fact that we're able to circumvent the bureaucracies of the public sector, okay, and still deliver superior value with the government cooperating with the private sector. So when you allow the private sector to lead and then government would support, the benefit ultimately comes back to government, all right? But you're able to now marry the benefit of and the speed of the private sector is still responding quickly and timeously, I mean, and incisively to the issues of COVID.
Mm-hmm. Right, thank you so very much. So, Dr. Franklin Esiedu Bekoin, I'm coming to you now, and I think that I would want you to rehash for us what the major challenges you are currently dealing with in terms of, the government designed approach. The minister spoke about, limiting and stopping the importation of cases, detecting and containing the virus, caring for the sick, reducing the impact on the social and economic life of citizens, and enhancing domestic capacity and self-resilience. So this is the government response. And from the health point of view, what are your major current challenges that you might need some support, some help, some collaboration to resolve?
Okay, thank you very much. I think that we have a number of challenges that will require the private sector and the CSOs to help us address. One big thing is to how do we get the population to adhere to the safety protocols. I think that it can't be wholly be an activity to be led by the private sector or the formal government sector. And I think that is one approach that we think that CSOs and NGOs are very much dominant in the lower levels in the country. So we think that their presence will help us achieve that perspective. So that the paradigm or the narrative is that we need to get Ghanaians to adhere to safety protocols. That's one thing we want to address. The other one is about testing. You know, your magnitude of your disease is dependent on your testing capacity. So we can see that there has been a big improvement in our testing capacity. We have moved from about 2 laboratories to about 14, but we need to have sustained testing capacity. So it's about reagents, it's about barcodes. So that's one area that we need to be sure that we are sustained on. Then it's about contact tracing. For now, to be sure that we are breaking the chain of transmission, we need to be able to follow all the contacts, and that one requires a lot of resources. Contact tracing is a very expensive endeavor, and that we hope that we can have sustained. We are doing more of electronic contact tracing, so we need more of some tablets, some computers, all to make sure that we can have effective contact tracing. Then the logistics. So far as COVID is not over, we always need PPEs. So the PPEs can never be enough. We make sure that we need sufficient numbers of these PPEs. And then the treatment centers. In terms of numbers, we have seen an improvement in the number of treatment centers, but we think that they need to be well equipped. We need to have ventilators, all those important things to make sure that we can have a very effective ICUs in place. Then about the isolation centers. For Accra and a few areas, we have quite a reasonable number of isolation centers, but for areas like Western region, there are challenges about having an isolation center that you can actually put a newly diagnosed case. So that's also a big challenge for us that we hope that can be addressed. So in all, we think that we are making strides in the fight against COVID, but there are still challenges that needs to be addressed. And I think that some of the things I've listed, when supported from the private sector and the CSOs and NGOs, we can be on the right channel, on the right course to address the threat of COVID. Thank you very much.
Thank you very much. And perhaps when you're concluding, when we come back to you for your concluding remarks, you may want this support. Is it technical? What areas now? Dr. Franklin.
Hello?
Yes, I said maybe you should just address it now. In what form might you want this, you know, support
Hi, Shamima. I think you're. Hi, hello, Shamima. I think you're breaking. So we couldn't hear the question, please.
Hello.
Yes, you are breaking. Sorry. So. Hello, Shamima.
Can I be heard now?
Yes, it's a bit better. Yes.
These are the down. So, Dr. Franklin.
Yes.
I was asking you to state in what form that you indicate should take. Hello?
Yes.
Dr. Franklin?
Yes, I think he went off. So can you please come again?
Shamima, can you perhaps type your question so that when you go off, we can still get it? If you can type your question so that even if you go off, because I think your connection is really weak and it makes it challenging to hear you clearly. So if you can type your question, and then just in case you go off, we can still continue to get the response.
Yes. Okay. Please continue. Can someone just, talk so that the place is not.
Okay, let me just continue. I think I got the crux of what Shamima was trying to ask. I think what Dr. Franklin shared with us were specific areas in which the government, the health service may need support. And he listed, I think, 4 or 5 areas. I think she wanted to follow up with a question on those specific areas. Are there any specifics that are priority that, that need immediate support from that need immediate support from civil society or the private sector? I think that's what she wanted to ask. So, Dr. Franklin Asiedu, which are the priority areas that the health service needs intervention as in terms of priority out of the 5 that you listed?
Okay, thank you very much. I think that for us, I want us to look at this adherence to the safety protocols as a collective approach, and because it's more of enabling, it's more of enforcement. So I think that the private sector should be on board. The CSOs, the NGOs, all should be on board. So to us, that is one sure way that we can be assured that we are actually fighting and winning the fight against COVID. So collective effort to make sure that we get adherence to the COVID safety protocols. The other one is about support for contact tracing. I think this is for this. Let me say that the central government or government of Ghana has been very instrumental in this fight against COVID. But this is a very expensive intervention, and we think that we may need direct financial support to get people to be moving vehicles, fuel, to get people to do effective contact tracing. Because I think that there are even comments from the general population that they are not seeing much of the contact tracing as they used to see. I think that this is one area that we think we need a lot of support to get it well effective. We have not stopped yet, but we think that it can be more improved. And then when it comes to about testing, I think that we need to make sure that we have sustained testing capacity. So we have had a lot of private people on board. There's an MOU which is being signed between the government and the private sector. We think that we need to have more support in terms of provision of reagents and other logistics to get the testing sustained. And then I'll end by saying the logistics, the PPEs, we still need to have them. And so that will mean the physical availability of these logistics. Thank you very much.
Thank you so much, Dr. Franklin. Thank you so much for re-emphasizing that all the areas are important and you need critical support in all these areas. So I think now we'll go to Alhaji Ibrahim Tanko, just for his closing comments about specific key lessons he feels that will help in terms of facilitating collaboration between civil society, the private sector and government. What are these lessons, and how do we strengthen this coordination and collaboration? What should we be doing now so that we can respond more effectively to COVID, but also to future pandemics and emergencies?
Right.
So, Mr. Tanko.
All right. So thank you very much. I mentioned a number of the lessons earlier when I was speaking, and I'll just reiterate a few. One is the whole issue around the holistic approach to addressing both the immediate and the long-term impacts of the pandemic. That a silo approach will damage us further, because then we don't look at the implications. So we talk about using more of online approaches to complement the in-classroom learning. But then what then do we need to do about access to internet, for particularly disadvantaged citizens? Because we don't address that, we don't do much about it. We talk about health impacts. What are we doing about the whole thing around the posting of, the deployment of resources to the less deprived areas of the country? So unless we see this whole pandemic thing as one that requires an integrated approach, we might be run the danger of addressing symptoms. I think the second one I've already mentioned is around the issue of the local philanthropy, the generation of funding internally to support civil society, but also our development efforts, that we would never get back to the whole situation of the previous situation where donors funded the bulk of the work of civil society or external donors. But I think we are going to a new situation, and we need to respond to that through the generation of internal resources that would require the creation and the strengthening of an enabling environment, and looking at, decentralizing local philanthropy to the lowest levels possible. I think the importance of decentralization as a strategy, for effective responses to the pandemic cannot be overemphasized. That the top-down approach of deciding what needs to be done, the one-size-fits-all, would not work, and would continuously work to the disadvantage of specific geographic areas and social groups. Mr. Moderator, you already mentioned the long-term impacts, that a lot of the focus has been on the short-term impacts. I think we need to look at the long-term, not long-term just because there might be another pandemic, but long-term in terms of how do we take advantage of the current situation to make the necessary systemic changes that would set us on the path of sustainable development. An American politician said, "You'd never waste a crisis." And I hope that we don't waste this crisis, but we use it as an entry point and an opportunity to rethink our model of development. And the last, of course, is that civil society needs to be proactive. We are saying that government is not consulting us, government is not involving us, the private sector is not sufficiently reaching out. Let's reach out to them, not just at a national level, but even at a local level, to see what initiatives are possible in terms of collaboration between government and let's not shy away from asking the difficult questions. This is an election year. A number of civil society organizations are a bit scared that when we ask these questions, they will think that we've taken sides and etc. But the questions have to be asked. What is the quantum of resources? Who is getting what? Where are they going? How are we accounting for that? We need to do that in order that we can learn it and be more responsive. Thank you very much.
Thank you. Shamima, you can go ahead, please.
Let me try one more time to see if I can be heard. Hear me? Charles, today is a bad day. Hello?
Yeah, I can hear you. Yes, we can hear you.
Right. So I think the next person to speak is Dr. Zakaria to also indicate areas of support that they require and how we might work towards, building a common platform to share.
Thank you so much, Shamima. Please, can you hear me?
Yes.
All right, thank you. Our side will be so glad if we get our partners coming on board so that we collect data on the vulnerable across all 16 regions. Once we have the data in place, it will be very easy to target the vulnerable with interventions. And so that's the first thing I will put as an area that we need. Because we all know that poverty is not static. If we collect the data this year, it's possible next year others would have grown out of poverty and some may fall in. So getting the initial data of the vulnerable across the country, this will be really welcome. And we call on our development partners, civil society organizations, and the private sector to partner us in this area. Then the other area we would like the private sector to come in is productive inclusion. We deal with the vulnerable, and majority of them are ready to work. And so the private sector, if there are areas you think you can engage or employ people with disability, this will be really welcome so that we don't leave anyone behind, as we also target them with our interventions. Then apart from that, we would like to have a framework or a strategic plan that we will all work towards with the private sector, with non-governmental organizations, and then government organizations where we work towards the same people so that we have a strategic plan, a consolidated one, so that we put into good use available resources.
Thank you. Thank you very much, Dr. Zakaria. I think by way of a roadmap, we will be getting Teko Saba to summarize what, key emerging themes are coming up as a result of this conversation. So we would like to end the panel conversation by now. I would like to say thank you to Mr. Senyo Hosi, Dr. Franklin Esiedu Bekwei, the Ghana Health Service, to you, Dr. Afisa Zakaria of the Ministry for Gender and Social Protection, as well as Mr. Amidu Ibrahim Tanko with the Star Ghana Foundation. So thank you so very much for joining us with your very wonderful contributions. I would now call on Teko Saba. She's the head of programs at Star Ghana to kind of like give us a summary of what we have discussed and some key recommendation to form the basis of a certain roadmap moving forward. I mean, Mr. Tanko has called out for government to reach out, but has also indicated that CSOs also have to reach out. And Senyo has spoken about the importance of leadership. It means that some leadership must lead the process of consolidating all of our various programs and interventions and ensuring that we, have a holistic systems approach thinking. So Teko Saba, take it from me if you can hear me.
Yes, good afternoon, everybody, and thank you so much, Shamima. Thanks for everybody for coming today. Today's overall goal was to ensure that we were promoting collaboration, learning, and documentation of stakeholders' response to COVID-19 in Ghana. I wanted to start from the goal so that we know that we have been able to achieve it. Today's space was to create a space for key stakeholders to be abreast with others' contributions to curb COVID-19 in the country, and also to create an avenue for others for stakeholders to complement each other's efforts in the view of combining resources and expertise to collaboratively and proactively outline a roadmap for all stakeholders. And I think we have done that enough in terms of getting a better understanding of the state's contribution, the civil society contribution, and the private sector's contribution. In summary, a few things that came up to me and my team. Number one, from what the Honorable Minister of Information spoke about, government's response was swift early in March because we already had a pre-existing public health emergency plan. And therefore, when COVID was discovered, we really quickly got into gear and started working around the health sector and around the health side of things. Number two, while it was the private sector that acted swiftly to respond to essential needs of vulnerable persons, the state also created the enabling environment by providing security to ensure that this happened well. There is currently also a high level of awareness, but we note that the high level of awareness in citizens does not necessarily reflect compliance. And we see that with the statistics that the doctor from the Ministry of Health shared with us, with people wearing masks and not wearing masks. And also the lack of data is glaring. And this comes out very clearly with the vulnerability assessments and the challenges that the Ministry of Gender, Children and Social Protection had in terms of distribution of food items to the poor and vulnerable. Further, one of the recommendations I think that is clear and comes up is that there needs to be a holistic approach to the work and to the way that we see COVID, because COVID has gone beyond just a health issue and it's now hydra-headed. It's an economic issue, it's a social issue, it's a gender-based violence issue, it's an educational issue, it's a religious issue, and therefore our response has to be within that space. And Mr. Amidu Ibrahim Tanku spoke about a systems approach to dealing with this, and I believe that this is where we have to go. We need to vision the future, which requires us to take a more strategic and longer term intervention than just the provision of immediate needs. Yes, that is important, but the future is also important in how we need to do this. And of course, at the local level, the work of the MMDCs are very, very important in taking this forward. In conclusion, I would like to say that, yes, COVID is here with us and it will be with us for a while. I would want to give us the analogy of the Adinkra symbol where two alligators have the same stomach, but different heads. We might be different sectors of the economy, civil society, the state, or private sector. But at the end of the day, Ghana is our focus. And eliminating COVID and its impact on Ghanaians is important to us. And therefore, we need to be able to work jointly together to ensure that that happens. Moving forward, civil society is always available, and based on the conversations that we have had, we would come together and share a much more longer term plan in terms of how to engage everybody that is involved. Thank you very much, and over to you, Shamima. Hello, Shamima.
I can hear you. Teiko.
Yes.
Many thanks. I think that you deserve a round of applause from all of us. I think it was a succinct summary of the conversations that the conversation we had this afternoon, and that just wraps up for us today's multi-stakeholder forum. Thank you all for participating. Thank you to West Africa Civil Society Institute, Nana Afajenu, as well as Mr. Amidu Tanko of Star Ghana Foundation for convening this platform. And as we have heard, in the coming days, we will be sharing a semblance of a roadmap of how we can better collaborate, complement each other's efforts, and cooperate with each other to fight COVID and also to envision a better future that will protect all the vulnerable in our society. We thank you for your time and we wish you a happy remainder of the day. Good afternoon. My name is Shamima Muslim. Bye for now.